Good afternoon. My topic for paper presentation is optical coherence tomography based subtypes of diabetic macular edema and its association with systemic risk factors. Moving on to the background, diabetic macular edema is the most common cause of visual impairment and blindness among patients with diabetes mellitus. Optical coherence tomography is a high resolution imaging technique that provides cross-sectional image of the retina and plays an important role in evaluating and managing diabetic macular edema. Systemic risk factors like hypertension, dyslipidemia, nephropathy can worsen diabetic macular edema. A good understanding of the systemic risk factors that can affect the development of diabetic macular edema is helpful in the management. The OCT-based classification of diabetic macular edema, we have classified into diffuse type, where there is spongy thickening, cystoid type, where the cystoid-like cavities, serous macular detachment type, tractional type, and mixed type, which can be a combination of the above types. The purpose of our study is to assess the spectral domain OCT-based subtypes of diabetic macular edema and its association with systemic comorbidities. The materials and methods, it was a retrospective cross-sectional study which was conducted in a tertiary eye hospital in central Kerala. 100 consecutive diabetic macular edema patients who underwent ocular examination and SD-OCT from Jan to May 2022 were included. The inclusion criteria were the eyes with clinically detectable macular edema having good quality SD-OCT images and central macular thickness more than 300 microns, which can be attributable to diabetic macular edema. The demographic data and information regarding the systemic comorbidities like hypertension, dyslipidemia, coronary artery disease, nephropathy and anemia were collected from the medical records. Best corrected visual acuity, slit lamp examination, dilated fundus examination and S2-OCT were done for all the patients. Moving on to the results, the demographic data, out of the 100 DME patients, the males were 51 and females were 49. The mean age group of the study was 62 plus or minus 5 years. In the best corrected visual acuity, we found the cystoid subtype had the worst best corrected visual acuity. In our study, we found that the cystoid subtype was the most common type, followed by diffuse. Then we had the tractional, SMD. The central macular thickness was the maximum in the mixed subgroup, followed by the SMD. Then we had the cystoid, diffuse and tractional. The comorbidities which was present in our study population was the hypertension was the most prevalent one, followed by dyslipidemia. Then we had kidney disease, coronary artery disease and anemia. We found that there was a significant association between the hypertension and the DME subtypes. We found that the p-value to be 0.019 less than 0.05 and it was considered statistically significant. The association of dyslipidemia, anemia, coronary artery disease and kidney disease, we could not find any significant statistical association. We also analyzed the ellipsoid zone loss in all these patients and we found that 58 out of the 100 patients had ellipsoid zone loss and the maximum ellipsoid zone loss was seen in the cystoid subgroup, followed by the tractional, diffuse, mixed and SMD type. Discussion. In a study by Sana et al., DME had been classified into diffuse, cystoid and subretinal fluid pattern based on the OCT. In that group, in that study, the diffuse retinal thickening was the most common type. In our study, cystoid type was the most common type. In the previous study, the central macular thickness was maximum in the cystoid subgroup. In our study, it was maximum in the mixed subgroup. In the study by Alcora et al., the worst BCV and the highest CMT was in the CME subgroup. In our study, the worst BCVA was in cystoid subgroup, which was consistent with the previous study. Aditi et al. Had stated that high BP was a significant risk factor for SMD. In our study, there was significant association between hypertension and DME. In a study by Durgan et al., micro or macroalbuminuria was seen as a statistically significant higher rates in patients with DRT. In our study, we could not find any significant association between the types of DME and nephropathy. So moving on to the conclusion. In our study, cystoid macular edema was the most common subtype of diabetic macular edema. Worst best corrected visual acuity and ellipsoid zone loss was seen in the cystoid subgroup, which helps in the treatment decision and prognosis. Systemic hypertension was the most common comorbidity and it was found to have significant association with the diabetic macular edema subtypes. These are my references.
What is the important risk factor for diabetic retinopathy?
Mainly the systemic risk factors like hypertension, dyslipidemia, nephropathy, anemia.
No, you're forgetting the basic
The,
disease.
the control of diabetes mellitus needs to be, is the most important.
Your study, nowhere you have included that the most important risk factor, that is the control of diabetes. Isn't that the most important?
Yes, ma'am.
And duration of diabetes also not included.
Last slide, no? Nephropathy is not associated, you said.
We could not find any significant association, ma'am. Statistically significant.
But the common understanding is nephropathy is related to the retinopathy.
Yes, ma'am.
Renoretinal, no? Renoretinal disease.
Yes, ma'am. Yes, ma'am.
There is a definite association.
Yes, ma'am.
Okay, good morning.